I've been to a lot of doctors, been on a lot of issues with my health. I graduated from chiropractic school and I also graduated with a nutrition degree. So I like to apply in my office chiropractic and nutrition. You know, I'm a big, strong believer, and I'm here to guide the patients and give them my experiences, give them what I learned, give them my lectures. There's more connection with your health and nutrition. Thanks for taking time out of your day to come. Appreciate it. Today we're going to be talking about my daily protocol, but mostly my September to March program that includes seasonal affective disorder, includes flu, includes making sure that in cold temperatures and all that you're adequately taken care of. And I want to go through how I came to this program and why it's a necessity as opposed to other programs out there that can really avoid a lot of misery, because we're into safety, efficiency, economic, and being able to do the right things without putting us in unnecessary situations. I always put this up because this is, we die because we have lack of knowledge, and knowledge is really lacking these days. They're using things that have some knowledge, but it's more beneficial from a business standpoint than a health and economic standpoint for us as the public. So my goal is to give you knowledge, and it's your choice whether you want to use that knowledge or not to improve your health. I like to read, we always read forward, but if you read this backwards, it says the leading cause of death, infection, immunodeficiency with resultant malnutrition. So you could read that both ways, forward and backward. Basically, that's the cause of death, is malnutrition. So, and I'll show you how every lecture, my research is based on proving that and showing that to you so you understand that, because that seems like when you read it, it's really oversimplified, because our bodies are really complicated, and and we do a lot of different things when we go to the doctors, but this is so simple that if you can get that concept, you'll understand why I do this as a business and why I'm trying to help people, because a lot of people are not doing this. This is my daily supplement protocol, pretty self-explanatory. There's just about a lot. We're going to talk a lot about this one here. It's called Boswellia complex. Fat loss. Everybody wants to lose weight. It's easy to lose weight. It's very simple to lose weight. My fasting 5-2 diet, this product here increases your resting metabolic rate naturally without doing anything differently. And I have that research article on my webpage at drkrygier.com. And then I also integrate now, Standard Process has a 10-day program instead of a 20-day program. So it's a good way to get you started. But if you're not doing some type of detoxification balance, moving chemicals, when you move these chemicals, you move fluids. When you take this, you increase proteins. When you increase proteins, you also move fluids. So a lot of us are really waterlogged. We don't have a lot of fat. We're just full of water, and then we start to get a little bit of the omentum fat. So a lot of people are holding water weight out there, and that's why their weight as they track it goes up and down, because that's the water weight. So this is a good process. Helps regulate your appetite, helps cleanse your liver, your kidneys. At the same time, raising your metabolic rate. So those two things are very affordable, they're very effective, and they're all pro-health. This is the Acera technology. This is my son, Michael. But this is such a comprehensive program that there's a lot of information to go on. People don't know where to start with their health. Acera testing is powerful. It gives you all your systems, plus it tests over 10,000 different frequencies against your nervous system, and then the software retrieves how you respond to those frequencies and measures that, and it tells you if there's an issue there or not, and then you can clear that with different treatments. Acera testing, the first tests cost $95, repeated tests cost $75. Basically, you're interested in examining and improving functional energetic status of your own bodies to improve your health. People, this isn't wait until you have a diagnosis for something. We all know that we have weaknesses in certain areas, and we need to highlight those and pinpoint those so that they don't come to bite you. Optimize current state of health. So that's what the Acera does. It's Star Trek medicine. It's hard to believe, but so is Wi-Fi, so are satellites. So are a lot of different things out there that we can't see. But this is basically where physics and science meet, and it does a fantastic job giving you good information. This was a funny little joke I found. Little Johnny attended a horse auction with his father. He watched as his father moved from horse to horse, running his hands up and down the horse's leg, rump, and chest. After a few minutes, Johnny asked, "Dad, why are you doing that?" His father replied, "Because when I'm buying horses, I have to make sure they are healthy and in good shape before I buy." Johnny, looking worried, said, "Dad, I think the UPS guy wants to buy Mom." I thought that was cute. Influenza is always a major sales marketing promo out there, no matter what drugstore you're at. But the key is, we're not trying to replace, they're trying to replace your immune system. We're trying to build the immune system so that our bodies can handle the virus correctly and get rid of it without causing a barrage of co-stimulatory things in the lungs and the sinuses, all that. So it's based on host factors of how you take care of yourself, how much sleep you get, what nutrition you have. And I wanted to talk about two shortcuts that I recommend, that the science is there, and that I use in my office. These are these two things just happened in the month of December. Okay, this guy, perfectly healthy, gets a flu shot, and now he's totally paralyzed. Okay, there's some weird paralysis in kids going on, which they're ending up the same way in kids, and I believe there's something good that they could take that will. This treatment has to be within 2 weeks of getting this to work the best. But whenever you're dealing with a polio or a neurological-like situation that affects the nerves, that affects the muscles, that causes the paralysis, I relate it to this next slide, which is basically an iodine deficiency. Iodine, which is potassium iodide that I use in the office, chickens used to get polio. And when you added extra iodine to the chicken feed, their polio went away. And their nervous system totally cleared up, and they didn't have to, you know, their whole polio likes to go after the greater plexus, sacral plexus. It resonates at a waistline level. So taking liquid iodine does a fantastic job in polio. It worked on the chickens, and the mechanism is the same. This guy, I don't know, maybe that was planned. I don't know. He's a senator. So this is what I play. In September to March, offensive play, I use IAG, which I'm going to tell you about is really cool in a second. Your biodemulsion, and then here's your liquid iodine forte. This is used to take the infection out of the cavity, especially the sinuses, the throat, and then the vitamin D actually activates your immune system and also deactivates another part of your immune system so you don't overreact to the flu by creating inflammation and irritation, and that's when you end up in the hospital. And then IAG actually primes your system so that you can kill the virus, and I'm going to show you something neat on that. This was the liquid iodine. The problem is we have a lot of, you see this chlorate was from rocket fuel. Now it's in a lot of our foods, it's in a lot of our waters, but it blocks thyroid gland's ability to absorb and utilize dietary iodine. Halogens, any of your halogens, chlorine, fluorine, bromide, are all in the same category in chemistry as all your halogens. All those block, like bromine's high in certain sodas that you don't even realize. Bromine's high in hot tubs. They use it as an antiseptic. But the RDA used to be 150 to 290. Institute of Medicine put it at 1,100, but this is just like if you're living in like the Garden of Eden or something and you got no problems. These guidelines, like for instance, they recommend, I mean, if you have polycystic ovary, if you have any type of things you're trying to prevent, women need 3 times more iodine than men because they got breast tissue, uterine tissue, ovary tissue, and fibrocystic breasts, uterine myomas, all those things are basically in iodine deficiency, or it might not be an iodine deficiency, but it might be an iodine treatment to take care, because it actually dissolves the cystic shell of that mass. This is the daily optimal health dosage, is 3,000 to 6,000 micrograms, that's micrograms. If you look at these ranges in iodine, Japanese consumption of iodine ranges are from 5,280 to 13,800 micrograms. That's a huge jump from, oh, you only need 150 to 290. So there's a lot of benefits if you want to take advantage, and there's a high ceiling of safety of using this, and you can get a lot of it and clear up a lot of additional problems just by supporting nutritionally with potassium iodide. Now, this is the most important thing, because in an immunology textbook, you will read that once a virus makes it into the cell, that is game over because the cell is now infected. At that point, there is nothing the immune system can do other than kill that cell. Killing that cell is called apoptosis. Okay? Well, what this Dr. Leo James and his group found was that a protein known as TRIM21 has nothing to do with fat, but this TRIM21 protein in the cell, it's kind of like a bouncer to the cell, found that this protein identifies the antibody and responds by killing the virus. The invading virus is wiped out in less than 2 hours to become entrenched in the host cell and start replicating itself. Dr. James said it's the cell's last chance to fight the virus, because after that it gets infected, there is nothing else the body can do but kill the cell. Okay? And killing the cell causes your immune system to over-respond to the cell that's being killed. So that's kind of like another form of autoimmunity. But the IAG that you take is called isolated arabinogalactan. It's basically from the larch tree. This arabinogalactan modulates, and they checked them on dendritic cells, and they block this. This is a bunch of inflammatory markers that go haywire when you got a virus. And that's usually why you end up in the hospital, because you can't control NF-kappa beta. But what they found was AG, which is arabinogalactan, or IAG, simultaneously with this other protein they all stimulated this protein 21, blocked the inflammatory cytokines, and suppressed the T cells. So they actually controlled an autoimmune reaction as well as an acute reaction at the same time. They don't have a drug to do that. This says that we conclude that arabinogalactan dampens the activation, leading to attenuated TLR signaling, which is this. This result is a reduced T cell activation capacity of DC. So basically they're saying it downregulates all your autoimmune situations. A lot of people are tired, fatigued, run down at this time because of low-grade viral infections they can't get out of their system. This would be a perfect primer to activate these cells, not only ones that you're catching right away, but ones that you're holding that aren't part of the cell yet into the center of the cell. So that's cool, and that research was done in 2016, and this guy, this Leo James from Cambridge Laboratory, will eventually probably get a Nobel Prize for this, because he basically, this is basically telling you the flu shot the flu shot does not target TRIM12, and he found out what actually needs to be targeted to take care of it. So they're going in the wrong direction with that stuff based on the science and his discovery. So that's what IAG is. And it could get your immune system up 28 times with daily use. After 3 months of taking it, it just kind of leaves it there. I can't get it up more than 28 times because you don't want your body to start attacking itself. So that's why, that's one of the reasons scientifically I use the IAG. And I never knew this when I put this together 9 years ago, but why people should be doing this for the flu. And there's the proof. This was a patient that came in, wants to get off medications, curious as to supplements, diet, and to calm symptoms. He's had Crohn's disease for 10 years. Okay, anybody know what Crohn's disease is? It's basically, you got 30 feet of intestine. It could be from your back of your throat all the way to your anus, and you got ulcers, mucus, blood, inflammation. He had a resection of his colon probably about 10 years ago because he had so much inflammation, they had to cut a piece out and then put the two pieces back together. to save his colon. Well, he came into my office 2 weeks ago, and he said, Mike, you're not going to believe this. He said, I was in the hospital. I said, oh, man, I must have did something wrong. And he says, no. He says, just wait. Just listen to the story first before you react. And he said, I went to the hospital. I was throwing up. And anytime you throw up, it's either you have a tumor in your head, you got a bad flu case, or you got a bowel obstruction and you can't move your bowels. Those are usually the three reasons, mainly, you'll vomit for no reason. Usually bowel obstruction. So went to the doctor. They took his history. Basically what happened 10 years ago when he had this resection, it strictured with scar tissue and everything shortened and blocked his bowels from moving, rest of his bowels from moving, and that's what's causing him to throw up from surgery 10 years ago. So when he first came in, probably about 1.5 years, 2 years ago, I put him on wormwood. I wanted to clear his old gut. I don't care. It could have been a parasite. It could have been a food poisoning. I don't care what it is. You're getting your gut cleared. Second thing was his gallbladder. Anytime you have colitis, Crohn's, irritable bowel, any type of problem down low, your gallbladder's not working. Your liver's not working. Your biliary system's not working because bile is necessary to move the bowels, sterilize the bowels, and to keep the bowels from drying out. Plus, they help you absorb fat-soluble vitamins for your immune system. So his monitor, I usually refer out after 15, but he was good. He was a good patient, and he wanted to do it. He was just like, I got nothing left else to do. But he tested for a 17 on AF beta food, meaning his gallbladder wasn't working at all. I usually refer out after 15. So I put him on 5 3 times a day. And he did that for a while. But the doctor came out and said, we know what the problem was. We fixed it. We read his history. He's got Crohn's disease. What is he taking? And they're like, well, he's not taking anything. He's got something he's taking, but it's nothing from the doctors. And he said, well, I had his intestines in my hand because when you have a stricture, they got to take your intestines out, they got to rewrap them, make sure everything is aligned correctly. You can get another one, another stricture. And they said, when we looked into his intestines, he had absolutely no Crohn's disease at all through his whole intestines, and he was perfectly fine. So, after we did the wormwood, we did the AF beta food, I told him, I see him once a month to get adjusted, but I told him, this is the product you're going to stay on until you're fixed. I don't know if it's going to take 3 months, I don't know if it's going to take 2 years, 10 years, but that's the product that works, and I don't know how quickly it works, but you had colitis for 10 years. I mean, it should be a month for every year you have something because of the situation. So I put him on Boswellia, 2 tablets twice a day. He stayed on it. We didn't, got adjusted, But the reason that this was turned on by me and I knew about this was because probably about 15 years ago, I learned that Boswellia extract is both safely and efficaciously, meaning it works. It appears to be superior over mescaline, which is Asacol. That's the drug they use. Pharmaceutical drug runs for about anywhere from 85 to 95 cents a pill. And you don't know, you could be on it for the rest of your life. But it says the benefit, the risk evaluation, it was superior over this drug. So That's what I used on him. There's some other things in it, but the Boswellia, also Boswellia works good for not only Crohn's, but osteoarthritis. It's a double A rating for osteoarthritis, and it's not a prescription, because there are no prescriptions for osteoarthritis. It's just what? Oh, let's take some Motrin, ibuprofen, and it causes more osteoarthritis and more cartilage damage. This is perfectly safe for any joint to heal up a joint. I put this in because he had stricture. I mean, I believe that if I would have known him a long time ago when he had that surgery, this is what I would have used going into his surgery and 2 to 3 weeks after his surgery, so he didn't create a keloid or scar tissue that actually has no elasticity to move, that just grows and clamps down. That's what caused his bowel obstruction. So this go-to cola blocks scar tissue from forming. A lot of products on the market, creams and everything, have this in it. Cataplex ACP helps resistance to infection, and Thiamex also helps with resistance to infection. But that wouldn't get in the way with any medications or nothing and be perfectly safe, but they never warned him that he was going to have a keloid or scar tissue. Blood chemistry. I have blood chemistry at my office. Just want everybody to know. Whatever you want to get, whatever we think you should get, I think is beneficial to do it at least once a year. Get your blood work looked at. We can look at 500 things, or we can look at 50 things. Whatever you want to do, wherever you are, whatever your situation is. I wanted to go real quickly over atlas. Everybody knows what the atlas is? Top bone below your skull that rotates. Probably one of the most powerful adjustments that you could do, because atlas being up here, these are all the muscles. Once that atlas is out, let's say on this side, this spasms, this spasms, this spasms, this changes. Now you have a short leg that chiropractors pick up. But all these changes neurologically happen just from an atlas. So I get a lot of people that say, God, I have my hand bothers me. And I say, well, it's in your neck. Well, it's right here. No, it's in here. So people don't understand. Your atlas could affect your whole body and your whole posture. That's one relationship. Then you have your axis that can cause a whole nother slew of issues, and C3 that can cause but this is just an example. It's one of the most important ones, because having your head straight and screwed correctly is key. These are the cervical misalignments. We get a lot of splinting when things come out. You can feel the muscles are tight, but there's a lot of splinting to hold that in. You can get direct mechanical irritation to the nerves passing through these muscles. You can also get direct mechanical irritation to the nerves, arteries, veins passing through this intervertebral foramen where the nerves come out. Okay? Also, the atlas is very close to the eustachian tubes. So a lot of kids that have ear, nose, and throat problems, if their atlas is shifted, it causes clogging and a buildup, and you can't get drainage. And if you don't have drainage, you got a major problem. You can take as many antibiotics as you want. You're not going to get rid of the drainage, and you're not going to get rid of the infection. So it's purely mechanical. You can actually have the tip of the dens. There's a dens that comes up, and the atlas rotates around it to compress the medulla. The medulla is part of your brainstem. So you can actually compress the medulla, and you can cause numbness and tingling in the whole body and think you have polio or some type of disease. So you can look at it from a metabolic standpoint, and you can also look at it from a chiropractic or a physiological standpoint, structural. There's traction on the spinal cord interferes with normal function of the nerve tracts by at least 2 probable means. Basically, when you've got the spinal cord being interfered with, you have the cerebrospinal fluid that can't flow correctly and can cause headaches. So taking care of an atlas is very, very important. Closing small veins of the spinal cord, producing a stasis of blood, loss of nutrients, and you lose nerve conduction. This is interesting. Zhang study provides information regarding visual disturbances in 83% of 111 cases treated over a period of 7 years, including 9 cases out of 12 blind eyes which regain vision. The authors indicate a finding or a correlation between poor posture, atlas, cervical spine, head, having your atlas screwed onto your head right, and visual disturbances. So that's pretty impressive with study on cervical visual disturbances and manipulative treatment. So that's why chiropractic's around. Just to let you know, it's not just, pop, it's to actually apply it to real conditions. Okay, a blonde walks into a doctor's office and says, "Doctor, what's the problem with me? When I touch my arm, ouch, it hurts. When I touch my leg, ouch, it hurts. When I touch my head, ouch, it hurts. It hurts when I touch my chest, ouch, it really hurts." The doctor replies, "Your finger is broken." This is just to let you know, we started carrying this. If anyone wants to get my slides or see the video, you can go to the webpage at spinepluschiropractic.com. Good product, good science, and it's all backed up. Here's some of the actions of it, just to put it on the slide so that people can see it. It's this column here. It's not that column. It's this column. I love the CBD oil for people that have cirrhosis of the liver. Also, the Go-To Cola, because what is cirrhosis of the liver? It's scarring of the liver. You lose that architecture of the liver or the Kupffer cells in the liver. When you lose that architecture, they don't work correctly. You can't process and metabolize. It's not soft and supple like this. So Go-To Cola and the CBD oil are two positive scientific ways to use it, because they're using it for a lot of different things, but this one does a good job. These are the activities that I talked about in the lecture. All right, let's get to SAD real quick. Seasonal affective disorder, basically estimated 500,000 people every year is believed to be caused by the imbalance of chemicals in the brain. Usually they'll find serotonin. Serotonin's the main neurotransmitter in their brain that makes you feel good. They'll also find high levels of melatonin because it's so dark that melatonin offsets the levels of serotonin. Sometimes people will just have a neurotransmitter defect where they're not flooding the synapses enough and they're clearing it too quickly, so they need a little bit more at this time of the season. Also, in seasonal affective disorder, usually people's TSHs tend to go up, meaning their thyroids start to work less. So pushing the thyroid a little bit safely, by looking at blood work, regulating serotonin and melatonin, and using the IAG protocol, because a lot of people are sick and tired and it has nothing to do with seasonal affective disorder. They just have a low-grade infection, or their bodies they can't reset the system. So those 4 things are just simple things you can apply that people could come into the office and get checked for. Not being able to stay awake, disturbed, uneasy sleep, oversleeping, lethargy, depression, social problems, mood changes, overeating, craving for sugar or carbohydrate, that's your serotonin, increasing anxiety, and weakened immune system. Suggestions for coping with seasonal affective: visit this doctor's office, educate yourself, family, friends about SAD to gain their understanding and support. Get as much light as possible and avoid dark environments during daylight hours. Allow natural light to shine through open windows and doors when temperatures are moderate. Exercise daily outdoors when possible. Coping with SAD: rearrange workspaces and work near a window or set up bright lights in your work area. Keep a daily log noting weather conditions, energy levels, moods, appetite, sleep times, and activities. They got a lot of applications, apps for your phone now on your sleep-wake cycles and your resting heart rate and your pulse and all kinds of stuff. These were interesting facts about SAD. SAD was discovered before 1845, but was not officially named until the early 1980s. Over 100 articles have been written on the subject since 1999. Rosenthal was the first one to write a paper on seasonal affective disorder in 1984. Medline has included a separate medical subject heading line for seasonal affective disorder, along the as a form of depression. And then as many as 6 of every 100 people in the United States may have SAD. SAD is more common in northern geographic regions like New England. We have 245 days of overcast in Michigan. So we're not getting as much as we think we're getting. We're not getting enough light. The most difficult months for SAD sufferers are January and February. Now, real quick, medical encyclopedia. Vitamin D is a fat-soluble vitamin that promotes the body's absorption of calcium, which is essential for the normal development and maintenance of healthy teeth and bones. Vitamin D helps maintain adequate blood levels of calcium and phosphorus. Is that it? That's what I read when I was growing up in school. That's right out of the medical dictionary. That's a terrible depiction of what vitamin D is. It's terrible. So I'm going to give you the rest of the info. This is the other thing I read out of the medical dictionary. Vitamin D deficiency can lead to osteoporosis in adults and rickets in children, but the excess doses can cause calcification in the kidneys, vomiting, kidney stones, because the body manufactures the vitamin after being exposed to sunshine. We only need 10 to 15 minutes of sunshine 3 times a week is adequate to produce the body's requirement of vitamin D. I don't believe that. Basically, vitamin D3, cholecalciferol, is made in the skin from 7-hydroxycholesterol. So if you're on cholesterol reducing medications, you'll have an issue making vitamin D. And a thermal process. Solar UVB extends 290 to 315 nanometers. UVA extends from 315 to 400. Vitamin D3 is converted in the liver to 25-hydroxy vitamin D3 or calcidiol. And then in the kidney and other organs, it's converted to its active. In my office, we use the active right off the bat. We don't even do the conversion crap. Forget all that stuff. We want to get it right into the system, right into the lymph system, right into where the immune system could use it. Here's some sources: margarine, oysters, fortified cereal, fish, dairy products, cheese, butter, cream, milk, fortified milk. A lot of these things we don't even, they're not even recommended to eat, especially these dairy products. I don't know about you, but I'm a butter guy. I love butter. This is probably one of the strongest implications of vitamin D, because it has been postulated by this guy that vitamin D is promoting healthy immunity. Forget about the bones, and that's all good and decent. Those are at the RDA levels. That's from 6 to about 18 of the dosage of vitamin D that cause, if you don't, that's where people get rickets in that area. And I'll show you the parameters. But what's interesting is in the epithelial cells, in the macrophages, which are a white blood cell fighting system, this antimicrobial cathelicidin, upon exposure to microbes and expression, is dependent on the presence of vitamin D. This thing right here allows the British Medical Journal to say that taking enough vitamin D, you'll never get the flu. That right there. That's the proof. Upon exposure to microbes, pathogenic microbes stimulate the production of an enzyme. This in turn rapidly activates a set of genes. The pulmonary defense. Presence of vitamin D appears to suppress the pro-inflammatory cytokines, that chronic inflammation, that wheezing, that thick viscous mucus, the alveolar cells from being released and being stretching. Vitamin D appears to both enhance the local capacity of the epithelium to produce endogenous antibiotics, at the same time dampen the certain destructive arms of the immune system, especially those responsible for signs and symptoms of acute inflammation. Cytokine storms operative when influenza kills quickly. So if you don't have vitamin D, influenza is going to get you pretty quick. Here's a study in Norway on vitamin D3 and the prognosis of breast, colon, and prostate cancer. Let's just skip ahead real quick here. Basically, the study on the cancer registry in Norway was, the results suggest that high levels of vitamin D3 at the time of diagnosis, and thus during the cancer treatment, may improve prognosis of 3 cancer type studies. So they're saying your chances of living longer are increased considerably. This mechanism here says vitamin D3 stops the growth of tumors. Is shown to be a potent negative growth regulator of the breast cancer cells in vitro and in vivo. So breast cancer, prostate cancer is very important, and this VDR stands for the vitamin D receptor. So you better have this vitamin D receptor working for you when you have a situation, especially in breast cancer. This is all the complicated stuff of what vitamin D does on a genetic level specifically. Inhibits angiogenesis. How important is that? Why do we do the thermoscan? What do we do the thermography for? We want to find if there is an alternative or ulterior blood supply to a tumor being fed in any area of the breast of a female. This inhibits angiogenesis, meaning you don't have it blocks the blood supply and stops the blood supply to a tumor. You have no blood supply, you have no tumor because you have no growth, because you have no nutrition. Pretty simple. Inhibits cell migration. That's another word for metastasis. Here's another one on tumors, D3. Very, very strong implications as anti-cancer research. Colorectal cancer. It says that it's 2 times higher in the Northeast than in the Southwest. The latest results from the literature regarding risk reduction factors for colorectal are reviewed in this essay. Let me show you something. In this, colorectal cancer mortality was inversely related to serum 25, basically vitamin D. They said if you kept your levels up to 80 nanomoles, which is very rare for people, you can go all the way up to 120 without calcium getting high and causing toxicity in the kidneys, calcification, stones, all that stuff. It takes a lot. We are really deficient in this stuff. It says a higher, which is 80, 72% risk reduction in the colorectal cancer compared to people who had less than lower than 50 nanomoles. That's huge. You don't get results like that off a stupid vitamin, which is a steroid in the body. This was the thought experiment. If we keep it, could be brought up to 80 nanomoles. Basically, 52,180 people will die of colorectal cancer. If you prevent 72% of these deaths, you would save 37,570 lives each year. To comprehend 38,805 people, the capacity of Fenway Park a year. You could nearly fill the stadium to the capacity of people. And colorectal cancer could be avoided each and every year worldwide. The United Nations estimates there are 500,000 deaths. Cancer report. You could save 360,000 lives each year just from making sure if somebody has this cancer, you keep it above 80. Here's a simplified example. 100 tablets, 80 IUs of international units of vitamin D can be purchased. This is the price, $750 per year. An expert on colon cancer at Memorial Sloan Kettering, that's a pretty highly prestigious cancer center, said one complicated case costs $250,000 to treat, one case. This is why everybody's got their mouth shut, and I'm the only one standing up here because I'm not getting any money for this stuff, and I'm the only one telling you this stuff. This is pathetic. It says the cost of chemotherapy is $250,000, so basically, thus the cost of treating one case of colon cancer would be enough to prevent the death from colon cancer in over 30,000 cases. Look at the economic relationship there. This is huge. So I thought this was interesting because a lot of females that have polycystic ovary disease, uterine myomas, any fibrous things that have effect from hormone dysregulation, they found that women that were trying to get fertile, 7% had normal vitamin D levels. So all your fertile women were very vitamin D deficient. This is a good multiple sclerosis. They already know that vitamin D is a cure for multiple sclerosis. I mean, very strong. Where's the mechanism whereby vitamin D reduces the risk of MS? Now fairly well understood. Okay. Here's diabetes and vitamin D. Vitamin D regulates insulin synthesis and secretion. by regulating the plasma calcium. Direct action on the beta cell function, so most of your diabetics will have bad vitamin D. Here's your autoimmune, which is your MS, your type 1 diabetes. Here's that cytokine expression I talked about, where the inflammation gets kind of crazy. Here's Epstein-Barr virus. Here's mononucleosis. All that stuff. So that's all your autoimmune stuff. Here's a beautiful, this was one calcitriol dose transiently increases this, forget about that, ameliorates or stops autoimmune demyelinating disease. You know how much, let me give you a little scenario. Do you know how much it is to treat MS a month? The medication, and it doesn't even ameliorate it, doesn't even have beautiful words like that in front of it. $3,000 for the medication every month. As a demyelinating disease treatment experiment, autoimmune, basically, right here, neurological deficits in mice, which was more effective than prednisone, has potential for reversing inflammatory demyelinating disease safely and cost effectively. This is the cash cow here. You take all the things, remember the definition of vitamin D in the medical encyclopedia? Well, hell, they don't want you to see this. Oh, it's just good for your bones. There's your fractures, there's your cancers, influenzas, other respiratory, that's infection in the blood, multiple sclerosis, cardiovascular disease, diabetes, congestive heart failure. These are in the billions. So that would make that 1 trillion, but the cost savings, you could save over $199 billion. How important is the sun to you? There's another inversely relationship. There's the flu one. Epidemic flu. You know, flu goes up, vitamin D, you don't have vitamin D, you're in trouble. Here's a summary of the evidence. Bacterial diseases, pneumonia, gingivitis, periodontal disease, septicemia, tuberculosis, viral diseases, influenza, RSV, and rhinovirus. How do you think all this stuff gets in there? Trim 21. I just told you, IAG. This stuff becomes part of your cells when you don't have adequate Trim 21 or something to push that and let it work more superior than it should be. That's the activity of IAG right there. One simple mechanism that guy's eventually going to get the Nobel Prize for. Laboratory tests. Some tests you can run for vitamin D. That's for osteoporosis, calcitonin, PTH. Here's half of all children are deficient. You know, they just sit indoors. They don't eat fish. I don't like fish either, so I just supplement it. Research found that a third of children tested were already showing signs of skeletal problems. Mommy, why do I have degeneration when I'm 30? Muscles and chiropractic. 150 primary care outpatients with persistent, non-specific musculoskeletal pain syndromes, refractory to standard therapies. They weren't getting better no matter what you did. 93% of them had deficient levels of vitamin D. They were at a 12. I'm going to show you what you have to be at, but they're at a 12. That's like just before rickets and your legs wobbling. It's like failing eyesight can be stopped by vitamin D. Macular degeneration is one of the most common causes. This was a study in the ophthalmology. Tufts Medical Center found that nutrients, beta-methionine, help reduce the risk, and vitamin D-rich foods. I use this for macular degeneration. You got your vitamin D, which is already emulsified, and then the bilberry. Anybody know what the color of the macula is? The thing behind your eye that the light reflects? It's purple. Bilberry is purple. It's got all those anthocyanins in it to help with the capillaries, help regenerate the macula, help with a little partial pressure like glaucoma. So vitamin D and bilberry are fantastic for macular degeneration. Vitamin D is found in milk, yogurt. We all know that. Will promote an adequate buildup. Okay, make sure vitamin D, we know that. Now, why you need more sun when you're over 50? New studies found that we need more of it as we get older. Natural levels fall as we get older. Low levels of vitamin D can cause a condition known as metabolic syndrome. What's that? You're fat. Your triglycerides get high. Your cholesterol gets high. Your waist gets bigger. Your sugars get out of dysregulated. That's metabolic syndrome. A study of 3,260 people, 3,260 people aged 50 to 70 found that 94% had low vitamin D levels. 40% metabolic syndrome. It's a global health problem. There you know it. Here's your ranges. Deficient, 0 to 5. Insufficient, remember that 18? That was 5 to 20. God, man, I got pain. Check your vitamin D. Hyper, not too much of it, 20. Most of the people that will come into my office, this is where I see them at, right here. Sufficiency is 40 to 100. No, it's not. It's 70. 75 to 100 is the sufficiency. Toxicity is greater than 120. Very hard to get up above that. And then your ideal is 7 to 150. These numbers are more, and then this came from another study in 2017 that said it needed to be higher. But the colon cancer study, or colorectal and colon cancer study, I believe was done in 2004. This is basically hypothyroidism, just to make you aware that your SAD could be hypothyroidism. Lift serotonin levels naturally for mild to moderate depression. This product, I don't know how this product is still on the market. I really don't, because in Germany, they use 3 times more St. John's wort than any drug that raises serotonin levels. Paxil, Zoloft, any of your serotonin reuptake inhibitors. The people love St. John's wort because nobody's really, who the heck is crazy? It's only mild to moderate. So they've been trying to get this off of the market, the world market, because, and Germany's one example of them taking advantage of going out to buy this and saying, we ain't doing the SSRI medications. We're not doing any of it. We can just use this. The only drawback to this is I usually stop this in March or April because you can get sun sensitivity to it. But 5-HTP is another way to raise your serotonin. So you could easily fix the problem with just these 2 things. I mean, it's not hard. It's already been proven. Thyroid function, there's your TSH levels, significantly higher in the winter. Now, a little bit on light and then we'll be done, but this is your typical luminescence of light. Your direct sunlight is 32 to 100,000. They call them lux. I'm not a light expert, but it's like 1 lume to 1 meter and how much it covers. But when you're dealing with seasonal affective disorder, you always look for lux. How much lux is given off. Direct sunlight's 32,000 to 100,000. Ambient, 10 to 25. Overcast, 1,000. We got a lot of overcast in Michigan. Sunset, sunrise, not sweet in this area. Moonlight, 1. Light, none. Or no light. Here's your typical lux in a hospital theater, 1,000. Supermarkets, 750, 750. Office showrooms, laboratory kitchens, warehouses, lobbies, warehouse aisles, homes, theaters, family rooms. Basically, you're not getting enough. You need about 10,000 to 25,000. This, to treat, 2,500 to 10,000 is what they say. This one right here, this was 5,000 lux. Guess how much that is? $40, Bed Bath & Beyond. So some people will, wow, I feel great with the light. Some people, you might need to D with it, or you might not need to D with it, whatever it is. But I'm just giving you ideas on how I approach this. But this one you would probably sit in front of for probably 30 to 60 minutes. Maybe putting on your makeup or have it when you're getting out of the shower, in the shower, always in it. So you need about 10,000 a day. And so 5,000 lux is good. And it's not too bright for you. Bergamot oil inhalation. Bergamot seems to do really well for a seasonal affective disorder. If people are into using oils, diffusing them. Got some good research on reducing cortisol, reduction of fatigue, anxiety within 15 minutes. That was a good study. So there's a couple different alternatives to using this. Bergamot essential oil help with stress, anxiety, insomnia, agitation, tension. Can also be used applied topically to the stomach or feet when diluted with a Krygier oil, like olive oil. So that's my play. IAG, Trim 21, biodeemulsion, antimicrobial, liquid iodine, antiseptic. Oh boy, so we all make excuses. As a fried, sugary, and high on fat food, too much of donuts can have a negative health effect. This is her talking. Believe me, honey, the donut producers and the shirt manufacturers are conspirators. All right, we have any questions? Yes?
So what happens after 3 months of the IAG?
It's nothing. You just can't get it up any further. You've already got your immune system there, and you just keep it there.
So like how long does it stay just
As long as you keep it up.
Okay.
Yep. You could take a break from it, take a month off, then go back on it. Yep. And it's a fibrous sugar from the larch tree, so it's a powder. So you do about 1 teaspoon every day in your apple juice or water, or obviously not milk. Yeah.
Had a bigger difference, like, oh, when it's not sucky.
Right. Yeah, it's a good product. Okay. And then let's do this. I got 2 things or 3 things. We got the 7 ketozyme. Who wants to admit they're fat and stand up? Who is this? Oh, it's Helen. So I did draw it. So Helen gets the 7 ketozyme.
I said I'm fat. It's okay.
See, your honesty. I just wanted to know who I can apply it to. That's it. And then the,
Only once a year.
and then the Zach gets the biodemulsion. And then Jane gets the de-stress. What do you mean? So, and then I'll make these slides available, and then Randy and his son, which do a great job, they're gonna have the video. So I'd encourage you to refer people. You know, in our office we do things. Everything's professional. I know the information, and we're really competitive getting people well. Very competitive. Okay?
Thank you.
You're welcome, guys. Thank you. There is so much information out there. You can go to my website. There's a lot of information on my website.